Namaste. Welcome to part 2 of Psychoanalysis Mixed Personality Disorders, call for revision of DSM-5. So far, we have covered what exactly mixed personality disorders are, how do they exist, how it can be identified, what are the different combinations which we see across in the therapy spaces. Going further into the discussion with our subject expert, Dr. Himanshu Vaidya. Sir, we were somewhere in the discussion where we were talking about how to go about with the healing process of these kind of permutation and combinations of PDs.
It's a very important question. The first is recognition. That unless we are able to recognize PD as a PD, we don't go for therapy. And if somebody remains undiagnosed or refuses treatment, then the suffering for a personality disorder is lifelong, and the person suffers in 10 different ways. And people around him also suffer in 10 different ways. So it's a very tragic state of affairs into which we are led if it remains untreated, either because the person refuses treatment or it just has never been diagnosed. So this is very important. The first part of the whole problem of identifying correctly the personality disorders, and especially the mixed ones. This is the first. The second part is the personality disorders at times can also produce very high productivity in some areas. And at a secret, deeper level, there can be a pleasure associated with those disorders. So these two have to be recognized as such and worked through. That the disorder may have produced very high motivation, which results in productivity in the real world in some cases. And there the fear would be, if the disorder goes, the productivity also will go. Which mostly is not true, but when it is true, even then, it is worth the trade-off in favor of health. And the deepest part is a secret pleasure associated with personality disorders. And that is often missed. So the conscious suffering is always reported and analyzed, but the secret pleasure is often missed. So that is second very important component about healing. First, that it should be recognized and treated. Second, that the person may have a concern of the productivity going along with pathology, which has to be addressed. The third is related to secret pleasure. And the fourth very important part is, what is the prognosis in general of all the efforts in this area? Is it a lost battle or is there hope? And I see this as a very hopeful situation. I go by the rule of 75. That 75% of the people will get healed 75% of the time, to the extent of 75%. And what remains, as Lacan says, that part of the core which remains untransformed becomes what he calls a symptom, where the symptom is separated from the suffering. The symptom is there, but so profoundly understood and accepted that the difficulty and the pain it causes is limited. We are no longer struggling with it. And therefore, we accept it as a part of our imperfection. And we...
Does it mean that the core remains unaffected with the superficially enveloping PD?
No, the core of the PD remains untransformed, whereas real component of the personality has transformed.
Okay.
Which means the manifestation will be that the narcissist no longer has the fragility which leads to catastrophic thinking and the disintegration of the self at the slightest of challenges.
Okay.
He no longer has the difficulty of interacting with people and not trying to dominate them. He no longer has the difficulty of accepting some forms of criticism. He would not have difficulty in accepting when something narcissistic comes out of him. He can smile at it. But the core is still untransformed, in the sense, if the stress becomes very high, the core can become occasionally active, which one recognizes and then tries to set it right again. And occasionally one may be overwhelmed by it. So even though the core remains untransformed, the 75% healing has happened, and there's a world of difference in the quality of lifestyle, the quality of life, and the productivity and creativity in the outer world, and also in happiness. So the most common outcome is this, that 75% of it is healed, the core remains, it becomes by and large harmless, but occasionally it can cause trouble, but never of the type it used to be earlier. So the tiger is now a pet dog who occasionally can bite or cause trouble. But both of you are vaccinated. So it is that kind of a thing, that the suffering is separated from the core symptom, the core difficulty. The core difficulty may produce a symptom or two very rarely, but never of the type that you experienced it before. So that is the most common thing. In some cases, you can a near complete cure, and in some it may be very difficult to move ahead. And those where it's very difficult to move ahead are this: 1, antisocial personality disorder; 2, fragile narcissism; 3, narcissistic personality disorder, where you have regression to primary narcissism. These 3 are those where it is very difficult to do therapy or to produce what I said, the 75% cure. So these are
even in schizoid. Even the schizoid is very difficult.
Many cases of schizoid. So these are some of the personality disorders which are very difficult to cure. But apart from them, I think the rule of 75% also applies to the chapter of personality disorders. That 75% of personality disorders in 75% of people, to the extent of 75%, they do get healed. So it's a very good prognosis to work with in general. And one more important element, from a holistic healing standpoint, karma also plays a part. It's only when the karmic load is worked out that the transformation really happens. So there is also a karmic component to the personality disorders in the causality of it and in the experience of it, if one believes holistically in reincarnation. So those who are holistically oriented healers, they do factor in this part. Component, very important component, is life experiences also are an important component in healing. It's not only therapy, it's not only the work of the patient on himself, it's not only the family member support, but it's also the life experiences. Often we see that certain events happen in life and rapid progress happens. And the best is when the patient calls you out of turn to have a session. When a patient calls for an unscheduled session, it's one of the most productive sessions in personality disorders. Because you don't have to do anything to get past the resistance. Everything is floating on the surface. In fact, it's boiling, and the boil has reached to the surface. So they are the most productive of sessions when the patient calls you for an extra session for personality disorders. So life experience is a very important element. Third important part that I would like to stress is often in personality disorders, this is not recognized very easily. They are often looking for that one person that they have always been looking for. It's like saying, only you can heal me. And the you is a very specific kind of person and often has suprahuman characteristics which are difficult to find in a normal human being. So often they are in search of that one person, that almost suprahuman omnipotent person who can heal them. So they are in search of the one. And it's like saying only you can heal me. And I can give two examples here of a diluted form of it. One diluted and one pathological, one real and one virtual. Bion, Wilfred Bion, one of the greatest psychoanalysts we had, and the master who founded the Bionian school. I mean, it got founded. He did not officially do it, but he is the founder of the school in one sense. Bion was a deeply traumatized person. And he underwent analysis with two very popular, very capable analysts. And both of them were psychoanalytic analysis, and both of them were long-term analysis. And he had his first wife, from whom he later, and after some time, married the second time, and he had the second wife. It was only when he found the second wife that certain parts of him started getting healed. Did not happen in the two analysis, did not happen in the one marriage. I'm not knowledgeable if he had some relationships, but never happened in anywhere else but with the second wife. That he found something there. We don't know whether it was safety or compatibility or what it was, or positivity or the healing capability of the person, unknown to that person maybe. Whatever it was, but the second wife was resembling to what we said, that only you can heal me. And the second wife somehow resembled to that you of Beyond. So often, apart from life experience, meeting some particular person who nears the one that we deeply believe only can heal us. And Jung touched upon this concept in a different way. He said it is the ideal man or the ideal woman we are looking for, eternus masculinus and eternus femininus. And that what we are chasing is loaded with the surreal, the mythology, and the suprahuman. But if by luck somebody real somehow can allow us to project on those things on that person, because the screen is capable enough of drawing those projections and holding on to them. And in some way, the person then is good enough. It may be that the person becomes the one we are looking for, the one who can heal us. So, apart from therapy, life experiences and the one who can heal you, they are also very important components of healing in personality disorders.
So, how about the roller coaster journey in therapy of PD or mixed PD? As we talk, there are layers to it, there are peaks to it, there are valleys to it. What it is all made up of?
In the therapy of personality disorders, the first thing to be clear is what are the personality disorders we are dealing with? Is it one or is it mixed? And if it is one, what is it? If it is mixed, what are they? So the first part is this recognition, clear identification, the clear diagnosis. And often this happens only over a period of time. It may not happen at the end of the case history or at the end of few sessions. It may only happen much later. So it calls for a long-term therapy. The second is to bring into discussion all the personality disorders so that the person understands and can cognitively try to manage, and then look at the feelings generated while each is active. The third is to deal with avoidance of therapy, which often comes in. That the more you go nearer to the core, the more you touch upon high affect release points, knowingly or unknowingly, there is a resistance to therapy. So the avoidance of therapy, the resistance to therapy is a very important component to be managed in personality disorders therapy. Important also is what stance do you take and when. In some personality disorders, the classical approach of interpretation may work. In some, the most strongest of them, maybe even a ISTDP approach can work. But in most of them, one has to start with the cohesion approach of holding, and only that slowly over a period of time get into the interpretative approach. And the moment we see that the fragility is getting disintegrated, the fragility is coming up, we are encountering fragility, we have to slow down. So the pace has to be calibrated very, very consciously. Because if it leads to too much of affect, too much of discomfort, the person will stop. What I call DAM, destructive affect mobilization. And I always say damned if you damn. That if you are not able to calibrate your intervention and too much affect is generated, the discomfort may be too high for the person and the person may eject out of therapy. So that calibration is very important. And the safest way is to start cohesion and then go into interpretative mode, and always use ISTDP techniques to know how to calibrate. ISTDP gives very good techniques to find out moment by moment the calibration of intervention, of mapping anxiety. Are we in the safe zone of anxiety? Are we in the unsafe zone? Are we in the highly unsafe zone? So this calibration is very important. In terms of the issues that we encounter in the therapy of personality disorders, there are some very common issues. One, we find the split open and working in different ways, the open split. Second, we find the four fundamental fears: the fear of death, the fear of pain, the fear of attack, and the fear of loss. And the fear of death is something that most deny, but it's there at the bottom of it. Attack and loss is easy to prove from what they tell us about themselves and the life events. So this four, projection is very important. The search for omnipotence and consequent projections on people, it's very important. The use of personality disorder as a dysfunctional solution towards that valley event, that the personality disorder is used by the psyche as itself a dysfunctional solution to something which is even more terrifying than the disorder. That is very important to be brought up. And the enjoyment, the secret enjoyment of the personality disorder, that one does not give up. Freud used to say, man will do anything not to give up his misery. That people cling to their misery, they won't give it up easily. So they will come crying, I want to get out of this misery, do something for me. But secretly they will cling to misery. And often it would be because of death instinct or masochism, but often it is because there is a secret enjoyment to it. It's like a person talking about torture in an exciting way. It's an exhilarating way. That is describing fantasies of torture, but his voice is completely exhilarated. He is happy. There is a smile on his face. He's not fearful. He's not under pain. He's not trying to avoid it. He's relishing it. He's relishing the narration of torture. And there is a exhilaration on his face. There is a smile on his face. So that's a very masochistic narration, that he is actually enjoying that pain in some way. So there is a secret enjoyment of what is a practical complaint. So this is something which is very important. As I said, we have to be careful about whom are going to leave us anyway. So fragile narcissists, usually they come because others send them to therapy. They don't want to come. So they are the ones who are definitely going to leave at some point, very soon, without completing therapy. Antisocial personality disorder, they are going to leave. They won't come. They also are pushed by somebody. And the same is true for narcissistic personality disorder with regression to primary narcissism. These three, most of the time, don't come on their own. They are pushed by somebody, or they want to impress somebody or fool somebody that I'm going for therapy. So they ultimately will leave. And what we have to do is to use the time that we have with them to accelerate the process and give them as much knowledge as possible, because we know they are going to leave. So give them knowledge which they can use on their own later. So when we see these three and we see the traits that the assessment is that it's not going to be there for a long time, we have to make best use of the sessions we have, and there we focus upon giving them knowledge which they can use when they are not in therapy, because we know that's going to happen very soon. So apart from these three, I feel very hopeful of near complete healing, I would say, 3/4 healing, and converting the rest, substantial part of the unhealed part, into a symptom. And I don't feel cynical about it. I feel as we march forward in knowledge and technique, we will find a cure for personality disorders. I am not pessimistic about it. I'm very hopeful.
Just a kind request with a suggestion that what if we go further into these mixed personality disorders along with the archetypes given by Carl Jung, and see how the positive traits can have the pathological versions also from a learning point of view for our viewers.
Yeah, it's a complex question, because let us say,
just few examples if you can correlate with certain different aspects which give us a better understanding how to sense the personality traits and have a relation with it's not just coming from the DSM-5 perspective, it's coming from overall view of personalities.
yeah. So let us say we are looking at antisocial personality disorder, and the archetypal equivalent will be the trickster, the unethical trickster. And the trickster archetype will be overactive in the person with an underactive moral archetype. So that is how the antisocial personality at an archetypal level will be playing out. So if we go into causality at the archetypal level of personality disorders in Jungian terms, we will find overactivity of certain archetypes, underactivity of certain archetypes. So if we look at the paranoid personality disorder, we see the hyperactivity of the predator archetype. That somebody is going to kill me. Somebody is going to attack me. If we get into personality disorder, it also is a underactivity of the warrior archetype. Partially running away from it, not having the courage to activate the warrior archetype inside of him. If we get into the narcissistic personality disorder, there is the hyperactivation of the hero archetype and the underactivation of the practical hunter archetype. That the practical man who goes out and hunts and brings for his family.
So when we see this, why I brought up this question was this can be a easier tool for the therapist to convey, as we talked about cohesion, holding, and later on giving the interpretation. And that can be an easier way of creating holistic healing for the person who has mixed personality disorder.
Right. So there are two levels of bringing this into therapy. Like one is the archetypes themselves. Like we can say the warrior part in you seems to be too strong. Or the child part in you seems to be too strong. The second way of bringing it into therapy, as Jungians do, is to use mythology. That when you narrate your experience, I'm reminded of a Greek myth. Say we are dealing with bipolar. That there is a Greek myth that there is a bird who can fly sky high, but the moment the sun rises, the bird melts and falls on the ground. The bird, phoenix. So it is rising in mania and then falling into depression. So that mythological thing can make the talk interesting and make it less attacking. It can create safety in one way. So it's a good way to discuss indirectly to bring in safety. And one can also find figures to say that, let's say, the movement has to be from, let's say, from a trickster to a wise old man. And this may not be easy because the trickster has provided good benefits lifelong. So everyone does not desire to turn from Valya to Valmiki. Most Valmikis remain as Valmikis and Valyas remain as Valyas. It is rare for a Valya to turn to Valmiki, and that's why we worship him and put him in books. So these are some of the archetypal, you can look at causality of the personality in archetypal terms and in mythological terms, because every archetype will have in literature, in mythology, some story.
True.
And also combinations of archetypes will have stories. Characters which are personifications of combination of archetypes. Like Krishna is a very good example of a benign trickster. He's an idealistic trickster.
Diplomat.
Yeah.
A diplomat, I call him.
So he is not Ram. He is not the moral archetype personified. He is a trickster, but he is an idealistic trickster. And that represents a maturing of the moral archetype. From absolute ethics, you are graduating to contextual ethics, which is a higher stage of ethics. So there is a stage in evolution of human beings of no ethics. Then you have absolute ethics, and then you have contextual ethics.
Very profound what you just said. So, traversing a new ground, it was an arena opening for me. Hope our viewers, you liked it equally. See you all again. Namaste.
Namaste.